Assalamualaikum warahmatullahi wabarakatuh. Allow me to introduce myself. My name is VINDA ARSITA. I'm from Gadjah Mada University. On this occasion, I will present my research entitled Relationship of Nutritional Status with Quality of Life of Elderly Patients Cancer at Rsup Dr. Sardjito, Yogyakarta. In this presentation, I will explain 5 things, namely introduction, number 2, purpose of the study, number 3, methods, number 4, result, and the last, conclusion. Alright, this research was conducted initially against the background of cancer is the second leading cause of death in the world. 60% of cancer cases and 70% of cancer deaths occur in the elderly. Most cancer incidents increase with age. This can occur because of the contribution of the aging process or aging in the elderly, which causes cancer risk factors, namely the progressive loss of integrity of physiological function. Cancer causes malnutrition, sarcopenia, and cachexia. 40 until 80% of cancer patients are malnourished during the course of their disease. This occurs due to the metabolic effect of cancer cells, cancer treatment, and change in metabolism. When this condition continues to occur, it can lead to a worse prognosis so that it can have an impact on the quality of life of cancer patients. Apart from this explanation, the urgency of doing this research is because there are no studies investigating the relationship between nutritional status and quality of life in elderly cancer patients. Alright, the next is purpose of the study. Knowing the relationship between nutritional quality of life in elderly cancer patients at Rsup Dr. Sardjito. And then the method in this research, this study used primary and secondary data with a cross-sectional study design conducted from April to May 2022 on 68 subjects aged 60 years who underwent cancer treatment at Rsup Dr. Sardjito, Yogyakarta. Based on the result of calculation based on the limit show, the minimal sample size used in this study was 52 elderly patients. Sampling was done by convenient sampling, namely all patients who meet the inclusion and exclusion criteria and were willing to participate in this study. Alright, this is the inclusion criteria. Number 1 is elderly male and female cancer patient more than or equal to 60 years. Number 2 is agree to participate in this research. Number 3, have a good awareness or compost mentis and can understand the research protocol. The exclusion criteria is undergoing hospitalization during the study period. Alright, the next method is the independent variable is nutritional status assessed by patient-generated subjective global assessment. And then the dependent variable is quality of life assessed by the World Health Organization quality of life. And the confounding variable is education level, income, cancer stage, and type of cancer treatment. Data were analyzed by person correlation test, umpire t-test, and one-way ANOVA test. The next is a result. Number 1 is different in PGSGA and WHO QOL scores based on the characteristic of research subject. Statistically, there was no significant difference in PGSGA and WHO QOL scores between patient groups based on education level, income, cancer stage, and cancer treatment. This thing is showed with p-value more than 0.05. And then the next result, number 2, is relationship between nutritional status and quality of life of research subject. The result of this study indicate that there is a significant relationship between nutritional status and the quality of life of elderly cancer patients. This is showed p-value less than 0.01, and elderly patients with moderate malnutrition or PGSGAB and severe malnutrition or PGSGAC have the impact of decreasing the total WHO QOL scores, so that it leads to a decrease in the quality of life of elderly cancer patients. Alright, the last is conclusion. Number 1 is nutritional status based on the patient-generated subjective global assessment or PGSGA has a close relationship with the quality of life of elderly cancer patients. There is a relationship that shows the better the nutritional status, the better the quality of life of elderly cancer patients. Number 2, there is no significant difference between education level, income, cancer stage, and type of cancer treatment with nutritional status and quality of life of elderly cancer patients. Alright, this is the end of my presentation. Thank you and wassalamualaikum warahmatullahi wabarakatuh.